sudden shortness of breath, that is a very atypical symptom. अरे इसको breathing difficult हो रहा है, इसको fan लगाओ, इसको वो लगाओ. This is what we experience. We have seen that, but that is not. This is a very atypical presentation related to the heart attacks. Another important things when it comes to the pain, that some patients, especially the females, will get a lower jaw neck pain. Please remember, lower jaw neck pain. Lower jaw neck pain is a typical presentation, is atypical, but this symptom we should not do any negligence, especially in the female patients comes with this pain in the neck. This is another atypical symptoms. Some patients will suffer from the interscapular pain, severe interscapular pain. Suddenly पकड़ नहीं मैं सुबह में कल रात में थैला लेके आया, शायद उसको पकड़ में आया मेरे को. So you should not neglect this kind of mistakes. Where I have experienced with many of my patients. ऐसा ही बोलते हैं मैं कल थैला लेके आया, चल मैं बैग लेकर उठाया, मैं इसके लिए. So these are the atypical presentations where they are misleading a doctor as well as they themselves coming and falling into a risk. So this is the another very important thing is that some patients experience a left hand radiating pain. This is very important thing. Certainly they will have, but the pain is not superficial, but it is inside the muscle, deep pain. It is a very deep pain. You can do whatever you do, the pain will not subside. It will not. That's a very deep left hand radiating pain. And another important, if you have a right hand radiating pain, is more typical heart disease. समझोगे heart attack हुआ ही हुआ. Of course, it is an atypical pain. We know where the books have also not told us that right hand radiating pain is indicates of heart attack, but the book says only left hand radiating pain. So this is a very important presentation where it comes to you that you should get into your mind. Just this gentleman might be having a heart disease. Right hand radiating pain is very important things. So these are a few atypical presentations. Some patients will present very significantly a retrosternal severe chest pain. Retrosternal sudden tightness in the chest. We can't. My patients, some patients have described, sir, as it if दो पत्थर के बीच में हाथ को रखे कैसा करते वो type of pain है. This is the patient language, not my language. Some patients have that much of severe pain. It is very severe pain. कितने भी पेन किलर्स दिए तो भी पेन will not subside. In fact, that much of severe pain they will suffer. So severe atypical pain we get, and sometimes this pain also associated with severe profuse sweating and icy coldness of the body, and may also present comes with the nausea and vomitings. See, this is the typical chest pain, but it is not mandatory that everyone should suffer from the severe retrosternal chest pain. Even in 10 cases, 1 or 2 patients may come with a severe chest pain, but 8 patients will not come with a severe acute chest pain in the retrosternal. They may come with the atypical presentation only. Well, in this regard, I can give you 1 or 2 examples. In the Bangalore, one young guy of 33 years, he has come in the casualty around 2:30, and they are compelled to see a cardiologist, hence forced me to go to the casualty, and I examined the patient, advice for an ECG. But that gentleman he refused and taking a doctor क्या बोलते हो मैं तो छाती में एसिडिटी की वजह से आया तो आप ECG निकाल रहे बोल के ठीक है no arguments and that I want ECG, if you want you please go for ECG, if you don't go for ECG I am not going to do anything. So I just documented in the case sheet and I left off. The same patient went out from the casualty and he was brought dead by 4:30. So this is the reason why in our special country, just what we have discussed, this is the main reason why the people are dying because of lack of because of overindulgence and lack of awareness about the heart diseases. They are losing their lives. I have seen many patients, almost every 2 days or 3 days, one patient will be coming in this way, and it takes us more time to convince them. Not only this, I will tell you another very good example. In 2002, when I was in Kerala, I was a consultant. One doctor's wife, he's a very senior, at that age he was 62 years. And fortunately, he has treated his wife since past 3 days, but her vomitings, her nausea have not come down. Hence, he was also a Rotary Club member. I was also a Rotary Club member. So through the president of Rotary, I received a call that sir, our Rotary member, Dr. So and so, his wife is not doing good, and that was a Sunday. Kerala Sunday में वहाँ पर even scooter पंचर हुआ तो पंचर करने वाले नहीं मिलते. That is a week off for them. We don't get anyone over there. So that is the reason why they have requested for me to attend that case when the gentleman has come to the casualty. Same story. After taking all the yeast and everything, I suggested, sir, I need one ECG. What doctor, what nonsense you are talking there? Then I asked only one thing, sir, why you have come to me? You are a specialist, then you should listen to me. You should. Then that president of my Rotary Club, he was convincing, when you have come to him for his consultation, when he was asking you to do some tests, you should do it. He was not willing with that. And you are treated since past 3 days and the patient's symptoms have not been subsided, and henceforth you want to see a cardiologist and you have come to me and you are opposing me. Anyhow, finally with the request and for the Rotary president, we took an ECG. The ECG have shown an extensive massive heart attack. Extensive means extensive massive heart attack. Then I should talk about now. Then emergency, then we took for a surgery and we did a double stenting, angioplasty, everything. And the patient have landed up with much more complications. She had developed into heart failure and all those things. Finally, she survived, but still that lady is alive. That lady is alive, but her husband is not alive. So it happens, sometimes it happens. So why I am telling that in atypical presentations, if you have an ECG, that is not going to do harm for us, but that is going to help us. That is a very good helping tool for us. So never do a mistake that whenever you have any atypical presentations, then you should better to have an ECG. It is a thumb rule, 1 + 1 2, just like it is a thumb rule where we should have an ECG. And of course, this anxiety, sweating, this is quite common symptoms about this thing. And we have covered this upper body discomfort and all those things. Next slide. Yeah, this is now the good important topic which everyone requires is the importance of lifestyle modifications. This is very, very, very important. So this importance of lifestyle modifications definitely which helps us in coming out, in preventing from these heart attacks. So in this, what we should have, what the preventive measures we should have. If you ask me, the first and foremost important, I talk about the diet. Shall I talk about the diet or shall we talk about exercise? Only one. Diet. Okay, we'll go for diet. Okay, diet. Very good. What kind of diet we were having nowadays? Oh, morning, what breakfast you had? Third bench. Up to you. Idli. Right. So diet is one. How many times we should have the food in a day? Please open your books and please write these important points which were not in the slides and go some. So diet is one of the most important, vital preventing of heart attacks. Diet plays a vital role. Diet plays a vital role. If I ask him the diet, even some patient says, "Oh, chicken nahi khana, baba, mutton nahi khana, machhi nahi khana, baba, I'm pure vegetarian." Do you say that if you are a pure vegetarian that you will not get a heart attack? Some patients ask me, "Sir, मैं तो pure vegetarian हूँ sir, मैं तेल भी नहीं खाता हूँ sir, मैं दारू भी नहीं पीता हूँ sir, अभी तक सिगरेट भी नहीं पिया sir, but मेरे को क्यों हुआ है?" It is not like that. If you don't eat a non-veg or if you don't have any other habits of alcohol, blah blah blah, what it may be, in those patients who's having these habits, they are more prone to have this heart attack comparatively this having alcohols and disease patients. So even if you are a pure vegetarian, we are prone to have the heart attacks, but the ratio if you take, it might be less in these vegetarians compared to the non-vegetarians. So it is not like that if you are non-vegetarian that you will get a heart attack. So ठीक है, if you go to the West Bengal, if you go to the Gujarati, West Bengal वाले तो हर सब्जी में बटाटा है, हर सब्जी में राइस ही राइस है और beautiful Bengali sweets. I like Bengali sweets. But again, just now I told that all the risk factors for the cholesterols are the sugars. If you eat a chicken, nothing will happen. But checking the show, मैं chicken नहीं खाऊँ, लेकिन रोज मैं 3 रसगुल्ला खा रहा हूँ, मैं बोलता हूँ नहीं सर, मैं रोज सुबह में, दोपहर में, शाम में 3 आम खाता हूँ, मतलब which is having a high fructose. Pharmacy students, how many of you know what is fructose, sucrose and glucose? Do we have any equipment to measure the fructose? Farmers people का आंसर वो ये तो बोलता है. We don't have any equipment to measure the fructose nowadays. Even the National Institute of Nutrition also, we don't have that equipment. We measure only glucose in our country. but even the Western countries, all up to the sucrose we have gone, but fructose we don't have any equipment to measure. Fructose are very glycemic index of sugars are very high, rich in sugars. It's a mango is one of the source. We're rich, but sugar cane is one of the source. So diet. So coming to the diet, I advise you that you should have daily 1 or 2 servings of very colorful vegetable salads. You can have the very beautiful colors. लाल कलर का है, पीला कलर का है, हरा कलर का है, सफेद कलर का है. बोलो मैडम और कितना कलर्स का है वेजिटेबल्स? एक दो कलर बोलो. तो मैं तो इतना बोल दिया. So we have lots of beautiful colors of vegetables where we have the vegetables. So try to have that vegetable in the form of the salads, the green leaf vegetables. And second thing, please consume the n number of leafy vegetables. Please consume the n number of leafy vegetables is another important criteria. And the third one, try to have the dry seeds like pumpkin seeds you can have, and muskmelon seeds you can have, and sunflower seeds you can have. These seeds really helps in increasing the HDL cholesterol and reducing the LDL cholesterol. So अगर आप तरबूज खाते हो तो please don't waste that seeds. Try to keep in a hot sun. When it get dry, time pass के लिए खाते जाइए. That helps you a lot. So this pumpkin seeds, so muskmelon seeds, so watermelon seeds, so sunflower seeds, so and totally to around 15 grams of dry fruits will help you a lot. Only 15 grams. Please write in a note. 15 grams of dry fruits will definitely help us in preventing from these heart attacks. This is the second important thing. And with the another thing, you can have 1 to 2 servings of fruit. अगर आप फ्रूट खाते हैं एक ही पर 3 फ्रूट्स मत खाइए. अगर इफ यू वांट टू हैव 1 केला, ईट मॉर्निंग 1 केला, इवनिंग यू हैव 1 सफरचंद, शाम को यू हैव 1 संतरा, but not 3 santaras at once. Never go for 3 santaras at once, or 3 kela at once, 3 mangoes at once. You can have it. Most of my patients ask me, sir मैं डायबिटिक हूँ, मैं सेब खा सकता हूँ क्या, मैं आम खा सकता हूँ क्या, मैं नारियल पानी पी सकता हूँ क्या? See, if you ask me that, you can eat anything what you like, but the condition is in moderation. In moderation. Chicken नहीं खाना. कौन से books have not told that you should not eat a chicken, you should not eat a fish. ये वो अच्छा है, ये अच्छा है, ऐसा कुछ नहीं. Fish is a vegetarian, non vegetarian. सोच के कल बोलना. Egg is a vegetarian, non vegetarian. वेस्ट बंगाल में तो भगवान को भी फिश देते. मेरे को एक जेंटलमैन was ask you, sir, it is a vegetarian, not vegetarian. I said, it is a not vegetarian only. So what is the difference between vegetarian and non-vegetarian? Can anyone please? Full party to afternoon. No one? Then you should give it to me then. What is the difference between vegetarian? कोई बोलता है ये इसमें life है, कोई बोलता है उसमें life नहीं है. Who said that there is no life in the vegetarian? Jagdish Chandra Bose have written books and books and books on about the plants. He said that it is the consciousness. It's not the question of life. It's the question of consciousness. Some young scientists from the USA, they argued with me. When I was in the UK, we come across in a conference, they said that, what nonsense you are talking to, Dr. Rao? Plants having the life, plants have the consciousness? Yes. J.C. Bose, who is the father of botany of our country, he has written many books about the consciousness in the plants. No doubt there is no life. That is the reason why if we can go for the vegetarian diet to a certain extent, but I am not so sure that some people say that some experts have shown that it is much more better compared to the non-veg. But the recent studies have shown that where they have given around 200 to 300 grams of mutton or liver they have given usually, but daily they have given 1 egg and 2 eggs also, but they have not got any problem. That is another episode, how to look very young, all the females. Really, this is a very good scientifically proven documentary, and about the diet management only. So how to look a 60. It has proven that a 60 years of female biologically she has become 40 years old in 2 months. That too, they have followed only 80% of the instructions what they have given. If they could have followed the 100% of the instructions, so they are definitely could free from all these very vulnerable diseases. Have we can come out from these heart attacks and 60 years, 40 years, whatever. It's great. So So diet is playing a vital role. So you can, if you ask me, you can eat anything, but in subject to the condition, in moderation. In moderation. So we have covered greeny or colorful, not very colorful leafy vegetables, a colorful vegetable salad, and we have covered the fruits of one serving and the two serving. Have only one fruit. If you like the sweets, you can have the sweets. Never, no books have said you should not take the sweets. You have one sweet, वो एक लड्डू खाइए, दो जलेबी खाइए, but don't never go for a pav kg, 1 kg jalebi. Don't go for 4 laddus or 5 laddus in a time. Just have one laddu. No books have said that you should not take. So if you ask me to come to the diet may you can have anything but subject to condition of moderation. And egg, you can have happily 1 egg, 2 eggs daily. Choice is yours. You can have the scrambled egg, you can have the omelette, or you can have the curry, or you can have the boiled egg. No books have said that मैं अंडा खाता कोलेस्ट्रॉल अब एक स्टाइलिश है भाई तू अब होटल्स में वो पीला निकाल के उधर रखते सफेद खाते हैं. That is no way that does not help us, never plays a vital role. You can consume the complete 1 egg, no any risk factors. You are not going to die if you get one egg. No. If you ask my wife, daily I have 1 egg, 2 eggs, daily I have. And what is my age? Anyone can guess me, please? 32 years. अंकल जी बोलिए मेरा उम्र कितना है? Very good. But looks like. So we are not. It is not going to harm us. It is not going to do it. I am 55 years old. Would be of 56 next year. So this is what I am telling, that everything you can have the subject condition in the moderation. Next important thing is the alcohol. This has become very big issue, sir. Alcohol the topic आ गया. कितना पीना है? मेरे को पेशेंट भी पूछते हैं. कभी मैंने वो डिलीवरी लेक्चर, सर दारू कितना पीना है? थोड़ा मोस्ट ऑफ पेशेंट दारू कितना पीना? परसों भी पूछा ना बस सर. क्या ना? परसों अपना लेक्चर में all senior citizens. That the first doubt, sir, दारू कितना पीना है? You can have the alcohol, and alcohol is also very good to increase and to develop the HDL cholesterol. And subject to the condition, again, in the moderation. Simply, thumb rule of alcohol is 14 pegs. कितने लोग alcohol पीने वाले? Please raise your hands. For them, this is the answer for. Ladies also, please. No any restriction for this. Girls, how many of you experienced the wine here, beer here? कोई भी नहीं है? झूठ है सरासर. ये सरासर झूठ है. No. So 14 pegs of alcohol, 14 pegs of any drink you can have in a week. If you have, for example, if you have taken 14 pegs in a day, the rest 6 days is a holiday for you. So, or if you ask me, you can have the 2 pegs. Really, you can see the book said that in each meal you can have the 1 ounce to 2 ounce of alcohol you can consume as a food item. जैसा अभी चावल है, सब्जी है, सलाद है, चपाती है, रोटी है. Like that you can have 1 ounce to 2 ounce of alcohol in each meal. Which breakfast एक है, lunch एक है, dinner एक है. That comes roughly about to over a period of 2 pegs you can have. Where it does not have any bad effects on your body. That is very important thing. What you, if you can have the beer, 1 mug of beer you can have on each meal. If you can have the what you call wine, one glass of wine, which is comes about 90 ml to 120, that you can have. I think Western country we have 50 ml. In India we have 60 ml 1 peg. That again that is difference. Please make a note that. 1 peg is I'm talking about the Western country styles. We call it shot बोलते हैं, single shot, double shot. यहाँ पर peg बोलते हैं. और पटियाला भी. How many of you know about the पटियाला? अंकल जी बोलो. खान में बोलो. Patiala is a very good, it's a double large peg here. Patiala double large peg here. So alcohol does not going to harm us if we can consume in moderation of 2 pegs in a day and 14 pegs averagely in a week. That does not going to affect us in any way. And the important thing is that in Maharashtra or the Bihar and the UP, if I see that tobacco consumption is like a what called idli vada sambar. Tobacco consumption is one of the most dangerous and risk factors if you come to the top, diet. Either you take by the smoke, or you take by the hookah, or you take the tobacco with sunna and all those things. This helps not only the heart, it helps you on the brain stroke and also to the vulnerable cancers. आप एक बार अगर आप टाटा मेमोरियल हॉस्पिटल मुंबई में जाके देखो तो जिंदगी में भी टोबैको नहीं खाओगे आप लोग. इफ यू सी यू विल गेट टीयर्स इन योर आईज एक्चुअली. कैंसर के लोग कितने लोग वहाँ पर पड़ा हुए हैं एंड कितना डिफिकल्टी से इवन समटाइम्स आई बीइंग ए डॉक्टर आल्सो it is very difficult for us to touch them also, but we do everything. But tobacco is not advisable. If you ask me, we should avoid tobacco as much as possible. We should be away from the tobacco to get rid from this heart attacks and the brain strokes and the most vulnerable and third richest causative factor for the death is cancer. For death is cancer. Tobacco is not advisable. And the important thing is the sleep. We have discussed the sleep. Sleep is very important to maintain your health, to come out from this heart attacks and the brain strokes, or even if you want to look very young, minimum of 7 to 8 hours of sleep is mandatory. Even the elderly age group people, if you are not getting the sleep, you take any pills for me, no problem. But it is mandatory for us, for you people to sleep sound sleep. Sound sleep, matlab, what is sound sleep? Can anyone please? What is sound sleep? We say that we should have 7 hours and 8 hours of sound sleep. ये sound sleep है क्या? Sound निकालना पड़ेगा फिर अपने. That is called sound sleep. Definition of sound and sleep, na? In fact, sound sleep in the sense that totally complete relaxation of the body. Totally relaxation of the body. When the body get relaxed, what it happens, the neck muscles will become very relaxed. So it's relaxed and comes down and obstructs the uvula or the sound box. That is the reason why when the air comes and goes, it obstructs. That is the reason why we get the sound. That is the sound. So complete relaxation of the body. It is mandatory. If you want to come out from this heart attacks, it is the mandatory 7 hours to 8 hours of sleep. It is mandatory. And I have told you also, if you sleep more than 8 hours, unnecessarily we are making our body going into a weak body. So if you don't want to get your body into weak, please don't sleep more than 8 hours. If you see in the olden days, even I have experienced